The topic of this presentation is the BRCA1 and BRCA2 genes and the predisposition of breast and ovarian cancer. The case associated with this topic is the Association for Molecular Biology versus Myriad Genetics. A private company requested a patent on a gene sequence that occurs in nature. Myriad Genetics patented the BRCA1 and BRCA2 gene mutations in hopes that their company can profit off these tests that are essential in a woman's health and risk of cancer. Women need breast cancer screenings, and especially women with a family history of breast cancer have a high stake. If women do not receive cancer screenings, the cancer can result in death. These gene sequences tests help determine diagnosis, management, risk assessment, and prognosis for cancer. The stakeholders include the private company, medical professionals, and the patients. Myriad Genetics took a huge step in the development of testing genetic mutations that can help women who are at a high risk of breast and ovarian cancer. Medical professionals can use the information provided through genetic testing to clarify treatment options and develop trials for the patients who are at risk. The women are also stakeholders in this situation because an estimated 270,000 women in the United States will be diagnosed with breast cancer every year. In the United States, there is a 1 in 8 chance that a woman will develop breast cancer and a 1 in 75% chance that a woman can develop ovarian cancer. Women with BRCA mutations face an increased risk from 50 to 80% of developing breast cancer and a risk of 20 to 50% for developing ovarian cancer. The importance of diagnostic genetic testing for the presence of BRCA mutations is critical. Women who are willing and able to test for these mutations can assist in leading them to preventative options, cancer treatments, and therapy for ways to treat for breast and ovarian cancer. There have been patents for over 4,000 genetic sequences. Before 2012, the availability for women to test for BRCA1 and BRCA2 genetic mutations was inhibited. Although companies expend significant resources to develop genetic tests that assess a patient's risk of cancer, natural products such as genetic sequences should not be allowed to be patented to ensure all patients have access to appropriate testing. The ethical principles of justice and utility conflict with the ethical principle of autonomy in this situation. Justice is described as fairness and equality within healthcare. Utility is tied in with justice in this situation because genetic sequence tests should be achieving the best outcome for the most people. Myriad Genetics' patent does not provide everyone with the access to the BRCA genetic testing, limiting the test to only those who can be tested through the private company. This patent does not promote fairness in the healthcare system because the access to specific testing that can prevent cancer among women is not accessible to everyone. The disadvantage to those who cannot afford through Myriad is significant. Autonomy is the patient's right to self-determinate, and this principle is held to the highest standard. Not all women can be tested if wanted, but it is in the woman's best interest to prevent or understand risks that can affect their health. Private companies also have the right to take responsibility and credit for their findings, but the appraisal undermines the importance of treating women. Justice and utility are far more ethical in the way the genetic sequences are tested. These findings encourage women to seek testing, which benefits both the women and medical professionals. According to the U.S. Patent and Trademark Office, patent laws protect new inventions and traditional tangible scientific inventions. These guidelines must align with the research goals of the institutions that are presenting the patents. The validity of the patent of genetic testing of naturally occurring intangible inventions is not allowed. Even though the genetic sequence testing aligns with the research goals of the Myriad, it is not in the best interest of all. In the 1990s, the AMA adapted the Code of Ethics so companies cannot patent genetic material. In 2013, the Supreme Court of the United States, in a unanimous decision, ruled that naturally isolated DNA is not patentable. The patent was granted to Myriad Genetics for the use of manipulated DNA that is not found in nature, including cDNA. But the patent was not allowed to patent natural genes because the genes are found in nature. Private companies cannot benefit from genetic sequences that are not available to all women. The principles of justice and utility play a major role. Without these principles in place, the availability and attainability of genetic mutation testing will put more women in risk. Women should not fear the cost nor availability that would turn them away for tests that can save their lives. A way that can prevent future conflicts can be for the U.S. Patent and Trademark Office to propose smarter and stricter laws. Therefore, private companies cannot create loopholes interfering with women who need testing to prevent cancer. The first case precedent that coincides with the findings was in 1982, the case of Diamond versus Chakrabarty. It aided in the development of patents toward gene sequences. This case determined that natural phenomena cannot be patented. In the case of the Association for Molecular Biology versus Myriad Genetics, this case can precedent future cases in healthcare systems to help bring awareness to genetic mutations and how genetic mutations can help test women for cancer.